Today, we have a rather unusual situation in the operating theatre. We had to come to the hospital as an emergency. The patient, who is not a bariatric patient, has an incarcerated ventral postoperative hernia. He previously underwent hernioplasty many years ago with the placement of a mesh implant, and at the moment, as you can see, there is a hernial protrusion, which is quite firm and painful. And it should be noted that the hernia has been incarcerated for about 3 days. There you have it. Therefore, it is necessary to perform emergency hernioplasty. Yes, 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 yes. Dear patients, we promise to show you the result of our Saturday operation, which was rather out of the ordinary for us. This is our patient Sergey, whom we operated on Saturday for a large incarcerated postoperative ventral hernia. It should be mentioned that before Sergey came to us, he had already been unwell for 3 days. Is that right?
Yes.
Could you tell us a bit about what happened to you?
Yes, I started to develop inflammation, but, in our line of work we didn't really pay much attention to it. There wasn't enough time to look after myself, so I ended up waiting until I had to have emergency surgery. I'm very pleased with the result, because I'd had a similar operation before about 7 years ago, in hospital. I remember how that turned out. The difference is like night and day. It's completely different. Now it's my 5th day after the operation, and I feel absolutely fine. As you can see, I'm moving about, I can sit down, I can move around, and even though, I walk, I live a full life, I'm driving again. A huge thank you to the staff, to Natalia Simonovna, to Roman Eldarovich. Really, the care was excellent, and the attitude was very good.
It should be mentioned that the patient went home on Monday.
Yes.
He had 2 small tubes in place, which were inserted into the subcutaneous tissue and above the mesh implant. We fitted the patient with a large mesh implant in the hernia area, as he had several hernia defects. One of them was strangulated, while the other defects simply existed. That's why we had to put in a mesh. The patient's temperature is normal, he is eating freely, and everything is fine with him. And he's happily and contentedly heading off to his dacha.
Everything is excellent. Have a great weekend, everyone. Thank you.